Hi class, my name is Alejandra Tejas. Today is September 16th, 2020, and today I will be teaching the class about chronic bronchitis. Now, what is chronic bronchitis? Let's break down these two words and their meaning. Chronic means severe, bronch means bronchi, which are the airways in the lungs. Itis, as you may know, is inflammation. Chronic bronchitis is inflammation and irritation of the bronchial tubes. This irritation causes mucus to build up, making it difficult for lungs to move oxygen in and carbon dioxide out of your body. This leads to a persistent cough for 3 months in 2 consecutive years. A typical patient presentation. A 45-year-old male presents with tightness in the chest. He reports problem with frequent coughing for the last 3 months. He consistently clears his throat of mucus. He wheezes when breathing. It is difficult to do any physical activity such as walking up and down the stairs. This causes shortness of breath for him. He began smoking at the age of 30 and smokes a pack a day since. His wife is also an active smoker. Etiology of the disease. Some of the underlying causes could be airborne pollutants such as cigarette smoke, excessive dust in the air, or chemicals. For smoking, we have active smoking or passive inhalation. We also have inhaled irritants, which get up into the respiratory tract. Another cause can be pollutants begins to cause damage in the bronchioles, which are the smaller airways in the lungs. And lastly, we have the alpha antitrypsin deficiency, which is a rare genetic disorder that inactivates elastase. Elastase is produced by white blood cells. For the background, we have number of adults with diagnosed chronic bronchitis in the past year of 9.0 million. For the percentage of adults with diagnosed chronic bronchitis in the past year, 3.6%. We also have women that are more susceptible due to having smaller lungs. The risk factors for chronic bronchitis include being at least 40 years old. It can affect both men and women. Also, being a smoker or secondhand smoking. Another factor is long-term exposure to other lung irritants such as air pollution. And lastly, alpha antitrypsin deficiency. Let's get into the pathophysiology of chronic bronchitis. To your right, we can see that we have a completely normal airway, and we also have an airway being affected by chronic bronchitis. As you can see, inflammation and swelling have caused the airways to narrow. And also, there is an increase in mucus production. The mucus glands in the airways help humidify and trap up any pathogens. Mucus production increases greatly, which is caused by irritants such as smoking or air pollution. The mucus buildup causes the airways to narrow. Goblet cells are also responsible for producing mucus as well. We have another image here showing the lung tissue going a little more into depth. Starting from the bottom, we have the submucosal glands, goblet cells, ciliated cells, the cilia, and all the way at the top we have the mucus production. Let's remember that smoking is one of our biggest risk factors, and this causes the destruction of the cilia, which makes mucus hard to get out, causing ciliary dysfunction. The cilia becomes short and less efficient. The mucus sits in the airways, causing it to narrow. Also, we have mucus plugs form, which cause minimal oxygen in and carbon dioxide out. We also have air trapping. In the carbon dioxide, we have buildup in the blood and less oxygen into the tissue, which leads to hypercapnia and also hypoxemia. The symptoms that we may see throughout chronic bronchitis may have no symptoms or only mild symptoms. As the disease gets worse, your symptoms usually become more severe. One of the first symptoms is frequent coughing, which produce a lot of mucus that looks clear, and this is because the mucus buildup from overproduction of the glands. Another symptom is wheezing, and this is because of the inflammation of the airway. Another one of the symptoms is shortness of breath, and this is because the air sacs are destroyed. This happens especially in physical activity. The old air from the last breath gets trapped inside the sacs. This keeps the sacs from filling up with fresh air during the next breath. One of our last symptoms is tightness in the chest, and this is because the airways are narrowing more and more as the symptoms get worse. For the diagnosis of chronic bronchitis, we have here a couple options in order to determine the diagnosis. For the first one, we have pulmonary function test, and the results that you typically can see there are obstructive diseases, and this means that the airways are becoming more narrow, making it hard for air to flow out of the lungs. Another diagnosis we can use is high resolution computed tomography, and these results usually show enhanced image resolution. Another diagnosis is x-rays. Results usually show bronchial wall thickening and enlarged vessels. Our last diagnosis could be the sputum examination, which results in off-white, yellow, or green mucus. And this is because of the large number of white blood cells in the mucus, causing this mucus to turn this color and look this way. For treatments for chronic bronchitis, one of the first ones that we have is to quit smoking. The tobacco will only further damage the lungs. And also another thing that we can add to this, for our case study, our patient did say that his wife was an active smoker, so it would be best to not be inhaling all this smoke. So it would be best to avoid being around someone who smokes as well. Another treatment is the bronchodilator medication. This medication helps relax muscle bands that tighten around your airways. And what this medication does is that it opens the airway and lets more air move in and out of your lungs. This also helps remove mucus from your lungs. For oxygen therapy, this is a treatment that provides patients with extra oxygen to breathe, and it can also be called supplemental oxygen. It is only available through prescription. And some of the things that are included are tubes or face masks attached to oxygen tanks. Having that shortness of breath helps this oxygen therapy aid that. So the last treatment that we have here is called pulmonary rehabilitation. This is a program of education and exercise to increase awareness about lungs and disease. You will learn to achieve exercise with less shortness of breath, And here we have the references that were used for this presentation. Thank you for listening to my presentation. Any questions or comments, feel free to send me an email, which is down below.